Bahrain now has the opportunity, through the American Mission Hospital healthcare system, to access Mayo,
which helps physicians here provide state-of-the-art care, which would be exactly followed in Mayo Clinic.
This membership is a vital step in KHAMH's goal to significantly bolster the level of care for the people of Bahrain.
It is 1 year since the Mayo Clinic appointed the King Hamad American Mission Hospital as a Mayo Clinic Care Network member. It became the first in Bahrain and the 15th international member to join this prestigious Mayo Clinic network. But how did the journey begin?
The journey to excellence for Mayo has taken several decades as a not-for-profit organization, and now they are the #1 healthcare institution in the world. And for the American Mission Hospital to aspire, as we designed in how we would become a leading healthcare organization, not just in Bahrain but in the region, was to have a collaborative partnership with this world's leading organization, the Mayo Clinics in Rochester. Our journey with the Mayo Clinics started almost 2 years ago, where we had a consultative agreement with Mayo, where the consultants came and looked at the American Mission Hospital from its foundation to where we are today, to see whether there was synergy and congruence in our value systems that would make AMH a worthy partner to the Mayo Clinic's values.
But how is this ongoing partnership, which is already 1 year, helping this hospital?
The partnership between Mayo Clinic and AMH in the past 1 year could be broadly classified into two. One facing internally and the other facing externally. And when I talk about internal facing, I'm looking at decision-making support tools available via the Mayo website, which is now incorporated into our website, which helps physicians here provide state-of-the-art care, which would be exactly followed in Mayo Clinic. So the Ask Mayo Expert is such decision tool, which is available to my physician here, who then uses that to counsel his patient.
So that's why usually you can know this from the manager.
The second benefit I can see is this training component, where we had 2 symposia. We've had 2 areas of development, pediatric diabetes and neurorehabilitation, and physician inputs in these spaces from Mayo to our physicians really helped this whole journey.
Discussions between the two organizations on matters such as pediatric diabetes are helping in offering better care for those in Bahrain.
We had a great experience with the Mayo Pediatric Endocrinology team. Their guidance strengthened our pediatric endocrine capabilities. And more importantly, this collaboration built a strong professional relationship that will support ongoing learning and future cooperation.
Both healthcare organizations are also discussing ways to build better neuro rehab facilities in the kingdom.
We recently had an excellent experience with the Mayo neurorehabilitation team. Across 2 consults, their specialists provided practical guidance and shared how they establish a neuro rehab center of excellence.
The insights from Mayo team have strengthened and enhanced our neuro-rehabilitation capabilities. And we are now implementing many of these practices in our own services, here in Bahrain at our hospital.
As a Mayo Clinic Care Network member, the hospital is able to have e-consults with expert physicians and surgeons from Mayo Clinic.
Through e-consults, KHAMH physicians can now connect directly with Mayo Clinic experts for guidance on complex cases, effectively providing patients with a vital second opinion without the need to travel.
Through our collaboration with Mayo Clinic, we were able to provide successful e-consults. These e-consults provided connection between our physicians and the expertise and guidance of physicians in Mayo Clinic. This gave us the reassurance of high-quality, world-class care to our patients.
The outward facing towards patients have also been a very good experience with some of the patients who were given advice by Mayo, which helped them make the decision in the right way.
I'd like to present to you a success story about a child who came to our hospital with having months of hip pain, which was later diagnosed to be a rare type of cancer called Ewing sarcoma. So for a parent to receive news like this, it's devastating. It really turns their whole world upside down. This family took their child back to their home country to receive advanced care as well as to have family support. But at the same time, they wanted to make sure they were making the best decision for their child, especially when it came to decisions like surgery and chemotherapy. So through the Mayo Clinic Care Network, we were able to present his case in front of a panel of expert doctors, including the surgeons and the cancer specialists. And they were able to reassure the family that their doctors were on the right track all along. So with that confidence, the family was able to move forward with surgery and chemotherapy. And the last news we heard was that there were no remaining signs of cancer, which is the greatest news.
The other thing is one of our physicians who had a very productive visit to Mayo Clinic herself in the space of high-risk OB, and that really helped advance her own skills when she's back, and she could use that to provide that to patients here.
For Dr. Saida, it was an exceptionally inspiring observership in the field of fetal echocardiography and in utero fetal surgery at the Mayo Clinic. She observed a wide range of fetal cardiac evaluations, including complex congenital heart defects and high-risk pregnancies. The highlights of her visit, she says, are her witnessing in utero surgeries, 2 laser ablations for twin-to-twin transfusion syndrome, and 1 repair of meningomyelocele.
More than 100 of our employees have gone through the clinical standards, quality standards that Mayo uses. And in addition, several of our leadership teams have gone through the leadership training that Mayo uses to train its leaders. So we are looking back just in 12 months, we have achieved a lot.
So these benefits have really helped in our journey, and I hope that this would grow in the next year.
We look forward to building on this successful foundation and collaborating for many more years as we work shoulder to shoulder with you, advancing medicine and extending the best care to all the people you serve.
And we are excited that this journey is going to be a long journey that will significantly impact the healthcare, not just of the American Mission Hospital, but the Kingdom of Bahrain.
Congratulations on your first anniversary.